Alright, so next I will demonstrate providing wound care using sterile wet to damp dressing change. So first, you want to review the physician's orders, review the patient's charting, and then you're going to go into the room, ensure the patient's privacy as well, close the door or pull the curtain. And you just go in, introduce yourself to the patient. You want to ask for the two identifiers. So you want to check their armband as you ask them their name and date of birth. Then once you do that, you want to ask if they are in any pain, and you want to ask if they have any allergies. If the patient is in pain, you want to give them pain medication 30 minutes prior to changing their dressing. So after you do that, you want to perform hand hygiene, washing your hands for 20 seconds, and then you want to don your gloves. So then after you don your gloves, you want to begin to set up your sterile field. So first you would gather your supplies for your sterile field. And make sure that the patient's bedside table, if that's where you choose to set up, just make sure that it is clean. So you have your dressing change tray. So now that you have donned your gloves and everything, you're just gonna set everything up. Then you want to pour your sterile saline into the tray so that your gauze can soak in the saline solution. So now you want to remove the patient's old dressing to expose the patient's wound. So you're going to inspect the patient's wound, and then also you would set up your biohazard bag, preferably near the patient, so that you can discard all of your biohazard dressing changes. So now you want to inspect their wound. You want to check the color, if there's any odors, if there's any signs of drainage, any just signs of infection as well. Okay. So then now you are going to also measure the length, width, and the depth of the patient's wound. So using a sterile swab, you could measure the depth. So you just stick it in, check with a ruler if you don't have one of those clear wound measuring devices. But usually if you do have that, you would just check and measure the length and width, and make sure to remember so that you can chart after. Then you would discard of swab sticks or anything that is contaminated now. And next you will take these. You want to clean your wound. Alright, so then next, usually you have cotton balls or some sort of material to use to clean the wound. So you're just going to clean the patient's wound as the physician has ordered, and discard of that. Then after, you want to doff your gloves, throw that in the biohazard bag, and since you are going to be closer and more hands-on with the wound, you want to don your sterile gloves now. So as I showed previously, how to don your sterile gloves to maintain a sterile field. We will don them now. Then you will take this and you will take your wet 4x4s and you want to just make sure to wring it out to where it is damp, not soaking wet. And then you're going to kind of fluff that 4x4. And then you don't want to pack it, but you want to spread it out enough to cover the surface area of your wound. So once you have done that, you will take your unfluffed 4x4, make sure it's not soaking as well, so you have it damp. You're just going to place that on top. And then next, you will take your sterile abdominal pad and you want to make sure that the blue side is facing upward. So you're just going to cover your wound. Then you're going to take your tape and you're just going to cover your wound. And then next, just write the date, the time, and your initials towards like the corner. And after that, you're going to dispose of your sterile gloves. You're going to clean up your bedside table. Make sure to dispose of the biohazard bag as well. And just make sure that the patient is comfortable. Ask if they have any concerns, questions. Put up their bed rail, lower their bed. Just make sure that the patient doesn't need anything for right now. Then just make sure the call bell is by their bed as well, so if they do need something, they can easily alert the nurse on duty. And then lastly, you would chart everything, document the date, the time that you provided wound care to this patient, document any drainage, any change in the condition of the wound, the size, and just any sign of infection or anything that you believe that is important for charting. And that is it.